Hi, this is Dr. Christopher Van Tilburg at the Hood River County Health Department. I want to talk about testing and our reopening plan in the county. But first I want to announce, if you haven't already heard, we have our 7th COVID positive case in Hood River. This is what we call a linked case, and that's the first case that we've identified that's been connected with a previously identified positive case. So all day today the health department has been doing investigation and testing under the new state guidelines, and working hard as we speak, late into the evening probably, to make sure that we get everybody notified and tested that needs to be tested. We aren't not going to release any identifying information about our two recent COVID positive patients, and as I mentioned before, the reason is this against the law, and so we only will release demographic information if it's important for public safety, and in this situation there's no reason to know any demographic information with respects to public safety. So the important take-home piece is probably that you should be aware of is that we know that there's COVID in our community, and as we do more testing as a county and as we do more testing as a state, we likely will have more positive patients. And so rest assured that the health department is investigating everyone to the best of our ability, and identifying and making contacts with people. I want to mention again about testing. There seems to be some confusing information about testing, which with good reason, because this is all new, this whole pandemic. There's the PCR test, which is the polymerase chain reaction test, which is the test for an acute infection. So we were testing just people that were symptomatic and needed health care attention, but we have expanded testing now, and so now we are testing people that are symptomatic but don't necessarily need medical care. We're testing some patients who are asymptomatic, and so we've expanded testing. This is a test that detects the genetic material of the virus, and it's done by taking a swab and putting it through the nose to the back of the throat, and then when we send it to the lab detects the genetic information of the virus, which signifies an active disease. Sometimes we can't detect it. It's not perfect. The tests are getting better, but originally the tests were only about 75% sensitive, meaning only 75% of those people who had COVID tested positive, and we were missing 25% of people. The test is getting better, luckily. There's another type of test, the antibody test, and it's really important to know that these are different tests. The antibody test is done with blood. It's either a blood draw from your arm or a finger prick, and the blood detects antibodies. It's also called serology, or it's also called immune globulin, and this detects somebody who's already been exposed to COVID. You may have been symptomatic if you tested positive for an antibody, or possibly asymptomatic, no symptoms whatsoever, and you test positive, and that means you were exposed to it sometime in the last few months. A really important piece here is if those people who test positive for the antibody can still spread COVID. You can still spread it. Okay, so just because you have some immunity to it or you have developed antibodies to it, it doesn't mean you can't spread it, because you can get it on your hands, you can get it briefly in your nose before your body fights it off, and you can spread it. So please be careful if you test positive. Don't be thinking that you can be totally reassured that you're not going to give it to somebody. The last thing I want to mention is reopening. So the county has been working very hard. We had a meeting today. We had a meeting earlier this week, a meeting with the health department officials and county officials and city officials from Hood River, city officials from Cascade Locks, and we're getting together. We have a pretty good draft of a reopening plan as required by Governor Kate Brown, and we are using the guidelines that we have been given. We're getting more guidelines every day, and we'll hopefully put this whole package together in the forthcoming week and get it to Governor Kate Brown, so we can look at what reopening looks like. For sure, I can tell you that reopening is not going to be turning a key and having the entire county opened and we're really concerned about people following directions and following the rules. And so, as you've probably seen in the news, there are some parks that have opened in Hood River, and our county trails have opened in Hood River. But we really are asking people to follow the rules and not come here from out of county yet until we are able to handle out of county visitors, and until Cape Brown lifts travel from away from your home. So please don't come recreate in Hood River. Thank you. Be positive, be safe. Thank you very much.